Let's start with a fact. According to the Kaiser Family Foundation, as of 2022, an estimated 100 million people in the United States, that's 41% of all adults, have some form of healthcare debt. That's a staggering number. And it's a reality my mom and dad, Leslie and Alan, know all too well. In the next 10 minutes, I'm going to show you exactly how we escaped that system. I'll share the powerful reason why we left, break down some staggering costs that we used to face, and then I'm going to walk you through our recent and pretty serious health scare here in Portugal, including every test, hospital stay, and the final bill. This is the video that shows you the real-world difference between healthcare in the US and what's possible abroad. We are Alan, Leslie, and Wolf, and for those of you who are new here, we moved from the US to Portugal a few years ago. This channel is all about our journey, and it's also become a community for thousands of people who are looking for a different way to live. We're not doctors or financial advisors, but we are experts in our own experience, an experience that's now been stress tested by the very thing we feared most, another major health issue. But first, I'd like to go over our more deeply personal story about my mom's parents, which ultimately became one of our catalysts for our move. Then we'll detail the US insurance system that we left behind, the cost, deductibles, all of that. After that, I'll explain the dual public and private healthcare system that is here in Portugal. And finally, we'll share minute by minute, euro by euro, the story of my dad's recent medical journey right here on this island we now call home. Maybe not minute by minute, but you get the idea. And before any of that heavy stuff, if you find yourself nodding along, or if this is the kind of information you've been searching for, please take a second to hit that like button and subscribe to the channel. And comment below with your own healthcare questions or experience. Every interaction tells YouTube that this is a valuable conversation. It helps our channel reach more people. Thank you. All right, so our why. This is the heart of it all. My grandparents. They were quintessential middle-class Americans. They worked hard their whole lives, saved diligently, did everything right. They had a plan for retirement. But that plan didn't account for the brutal reality of American healthcare costs as they came to their later years. My mom and dad especially saw firsthand as my grandparents' retirement savings, everything they'd worked for, their nest egg, the money they wanted to use for travel and to spend time with their grandkids, like me, just evaporated. It was something I grew up with all of my life. It was one prescription after another, one copay, one unexpected hospital stay. It was a very slow, painful drain until there was nothing left. They ran out of money. The stress, the constant worry about the next bill, it overshadowed everything. And so my parents were left looking at their own future. I was too. We were ultimately going to be on the same path. We knew absolute certainty if we stayed that would be their story too. We decided right then and there that we had to find a different way. We refused to let health and financial future be a source of constant fear. That was the moment the idea for moving abroad was born. Truly, at least. They had to do it so that they could ensure that they would never run into that issue themselves. So what exactly were we running from? Let's talk numbers. Our last health insurance plan in the US was with Blue Cross Blue Shield. For our family, the monthly premium was $900 plus the money the company paid. That was just the fee to have the insurance before it paid a single thing. But the premium is just a start. We had $7,500 per person deductible. This means if my mom, Leslie, went to the doctor, she had to pay for 100% of her own medical costs until she'd spent $7,500 out of her own pocket in that year. Only then will the insurance start to share the cost. Same for me, same for my dad, $7,500 mountain to climb. You get it. And even after we hit that insane deductible, it wasn't over. We had a 70-30 split, which is also called co-insurance. So now let me explain that. After we paid the first $7,500 per person, the insurance company would then pay 70% of our bills. We were still responsible for the other 30% until we hit an out-of-pocket maximum, which was even higher. A single major incident could easily cost us $15,000 to $20,000 a year with good insurance. It's a system designed to keep you paying. So then, how does it work here in Portugal? First, Portugal has the SNS, the Serviço Nacional de Saúde, which is its public universal healthcare system. It's primarily funded by taxes and it provides care to all residents, including us. It's a robust system, but like many public systems worldwide, it can be stretched thin and have wait times for non-urgent procedures. And this is a really important point for us, ethically. We are the immigrants here. We didn't pay into the system for the last 40 years like a Portuguese citizen would have. So in part, we feel a responsibility to not overburden a system that wasn't built for us. That's why we believe so strongly in having our private health insurance. It gives us immediate options, it provides a safety net, and it allows us to use private facilities, taking some of the strain off the public SNS. Our private insurance is with a company called MGen, M-G-E-N. Now, because of my dad's age, our policy is considered expensive by Portuguese standards. We pay €370 a month for both my mom and dad. The deductible is €500 for the year for all of us, and after that it's 100% coverage for most things. Just compare that. $900 a month in the US with $7,500 per person deductible versus €370 a month here with a €500 deductible. Peace of mind is priceless. So then, after those numbers, let's just go on to the case study, the story of my dad's adventures in the hospital. Last month, he started having some concerning health issues. The first thing he did was call his private primary care doctor. After describing the symptoms, his office didn't just book him for an appointment next week. No, they said, based on that, you should go directly to the emergency room at the private hospital. So he did. He walked into the private ER, was seen quickly, and within a few hours, they had run extensive blood work, x-rays, and an MRI. That alone in the US would have cost thousands of dollars. Here, they did it all. But then the doctors determined that his specific condition required a specialist that the private hospital didn't have on staff at that moment. The best person was available at the main public hospital. Now, this is where the system's great. The private hospital contacted the public hospital, explained the situation, told them that he was coming, and sent over all the test results they had just run. Before he left, he paid his complete bill at the private hospital. So, what was that bill that was paid at the private ER? It was €55. That's it. Then he drove over to the public hospital. He was taken right in. They ran even more specialized tests and decided to keep him overnight for observation. He had a bed, incredible care, constant monitoring. Next day, he was discharged. Drum roll again. The cost for the ER visit, all the tests, and the overnight stay at the public hospital was €0. Nada, nothing. 5 days later, had a follow-up appointment with his specialist, this time back in the private system. They wanted to run another set of tests just to be thorough and spend more money. Of course, that's why. Wasn't any fun. And so what was that additional money that was charged for these additional tests with this specialist visit? €20. After reviewing everything, the specialist determined he needed a procedure to take some biopsies, which required being put under general anesthesia. The procedure was scheduled at the private hospital. The insurance, MGen, gave pre-approval for everything. That clearly stated that his total out-of-pocket cost for this entire episode, from the first ER visit to this surgery and a second overnight hospital stay, would not exceed the €500 deductible. And that included the €55 and the €20 that were already paid. So then, what's this story come to? Recently, my dad went in, had a surgery, was kept overnight in a private hospital for monitoring, and was discharged the next day. The care was incredible, the doctors were top-notch, and we never once had to argue with an insurance company. There was no stress at all. So, recap. 2 emergency room visits. 1 at a private hospital, 1 at a public hospital. 2 overnight stays, blood work, x-rays, MRI, CT scan, multiple other specialized tests, 2 specialist appointments, surgery under general anesthesia. Total bill will be at most €500. Honestly, can't even imagine what this would have cost in the US. Tens of thousands of dollars, for sure. And beyond the money, imagine the months of fighting with the insurance company, the random bills showing up 6 months later. Oh, those don't actually happen here. But it's just would have been endless stress. We had none of that. It was all done quickly, efficiently, and with the doctor that was chosen, it was healthcare, not health business. Look, this is a lot to take in. If you're feeling that same dread we felt, we want you to know you have options. And we're here to help. We host a monthly online meetup where you can ask questions and connect with other people on the same journey. We also offer one-on-one consulting calls if you want to talk through your specific situation with us. And for those who are serious about making a change, we have our comprehensive Moving Abroad program that walks you through every single step. You can find links to all of these in the description below this video. I just want to end this by saying thank you. Thank you for watching, for being a part of this community, and for trusting us with your time. Your support means the world to us, and it allows us to keep making these videos. It's proof that you don't have to live in fear of getting sick. There is a better way, and we should have done this sooner.